Pregnancy test. This is the first test that you'll take. This test can be taken at home as a urine test or in a medical setting by testing the blood. In both tests, the presence of HCG is looked for. Your body will start to produce this hormone from the time that a fertilized egg implants into the wall of your uterus. At your first appointment, you will get some of your blood tested for the following. Blood type. Rh factor. This is the plus or the minus after your blood type. If you're negative but your partner is positive, it's likely that your baby may be positive as well. If that's the case, you may start to create antibodies that can attack your baby's red blood cells. Your provider will give you a shot of immunoglobulin around 28 weeks to prevent this from happening. Iron levels, to determine if you are anemic or not. Immunity to German measles. If you're not immune to German measles and you catch it during pregnancy, your baby may also get sick and his or her heart, hearing, or eyesight may be highly impaired. If you're not immune, it will be suggested that you get the vaccination immediately after birth. Hepatitis B. You may be the carrier of Hep B and not even know it. If you pass the virus to your baby either before or after birth, his or her liver can be severely damaged. If you're found to be the carrier of Hep B, your provider will suggest that your baby receive the vaccination immediately after birth. Syphilis. If you're carrying syphilis and pass it to your babe, this can cause abnormalities in your baby. It also has been linked to stillbirth. If you're carrying this virus, your provider will treat you with penicillin. HIV/AIDS. If you find that you have this infection, there are many medications that can be offered to prevent the spread of this virus to your baby. A urine test is also used to assess bladder or kidney infection, diabetes, dehydration, and preeclampsia by screening for high levels of sugars, proteins, ketones, and bacteria. High levels of sugars may suggest gestational diabetes, which may develop around the 20th week of pregnancy. Higher levels of protein may suggest a possible urinary tract infection or kidney disease. Preeclampsia may be a concern if higher levels of protein are found later in pregnancy, combined with higher blood pressure. You can also expect that at each appointment you will have your weight, blood pressure, and temperature taken to look for infection or indication of preeclampsia. Ultrasound for nuchal translucency. This is an ultrasound done during the first trimester, usually around week 12. This will be the first chance for you to see your baby. Your care provider will use this test to look at the spot on the back of your baby's neck. If there is extra fluid, this can be an early sign of a birth defect. This test does not diagnose. It is only one of many indicators that there may be a chromosomal abnormality. During this ultrasound, your provider will also check the age of the baby. Cell-free fetal DNA testing, also called non-invasive prenatal testing. This tests your blood for your baby's DNA to see if he or she has a certain genetic condition. This test is done after 10 weeks. Your provider may suggest that you get this test done if your ultrasound shows that your baby may have a birth defect. If you aren't likely to have a baby with a birth defect, or if you're carrying multiples, this test is not suggested. CVS, chorionic villus sampling. This test is a more invasive test that will give you a definite yes or no on whether or not your baby has a birth defect. This procedure tests the tissue around your baby by either inserting a catheter into your cervix or by inserting a long needle into the abdomen. This test will look for over 200 different birth defects. This test may be suggested if you're at least 35 years old or if there is a higher risk that your baby may have a birth defect. It's typically done between 10 to 12 weeks. There are some risks. 1 out of 100 procedures will lead to a miscarriage. This test is not recommended for women who have an STD, or who are carrying multiples, or who have experienced vaginal bleeding during pregnancy. Maternal serum screening. This is a blood test looking for specific substances, AFP, HCG, and estrol, and sometimes inhibin A. Levels of these substances that are too high or too low can indicate certain genetic abnormalities. This test is performed around 15 to 20 weeks gestation. Amniocentesis. This is a test that is performed by inserting a needle into your abdomen to retrieve some of the amniotic fluid around your baby. This test is suggested when a triple or quad screen comes back with a high risk of birth defect, if the mother is at least 35 years old, or if the risk of birth defects runs in your family. It tests the amniotic fluid for your baby's genes, determining whether or not he or she has an abnormality. This test can give you definite answers and can also determine the baby's gender. This test is usually done between 14 to 20 weeks. There are some risks. The risk of miscarriage is somewhere between 1 in 400 and 1 in 200. The needle may come in contact with your baby during the procedure, but great care is taken to make sure that this doesn't happen. Your provider will use a sonogram during the procedure to see exactly where the needle is. Other risks include cramping, leakage of fluid, minor irritation at the puncture site. Less common is a procedure that will test your baby's genes called condensed, performed after 17 weeks, where the blood from the umbilical cord is tested instead of the amniotic fluid. Glucose tolerance test. This is a blood test used to determine if a mother has developed gestational diabetes. The mother is required to drink a sweet liquid and wait a period of time. The blood is taken and then tested for glucose levels. If you have gestational diabetes, your provider will advise you on diet and may suggest that you test your blood at home periodically, or even use insulin shots. If you have gestational diabetes, you will be monitored during labor and given insulin and glucose to keep your blood sugar even. This test may or may not come in two parts. The first one is a 1-hour test done around 28 weeks, allowing you to wait only 1 hour between drinking the glucose and having your blood drawn. The other is a 3-hour test, allowing you to wait 3 hours between drinking the glucose and having your blood drawn. This test, the 3-hour test, is only done if the first hour test indicates that you may have gestational diabetes. If you have a condition which indicates it, you may be tested earlier in pregnancy as well. Group B strep. Your provider will swab your vagina and rectum to detect the presence of Group B strep. If you're carrying this virus, you will be giving an antibiotic during labor to prevent your baby from catching it. Fetal non-stress test. This is a test performed in your doctor's office to determine whether or not your baby is in distress. Your provider will place electronic fetal monitors on you and allow you to relax for about 20 minutes. The monitors will notice any contractions and in turn your baby's response to them. This test is usually done after 40 weeks. Biophysical profile. Your provider may or may not suggest that you have this test done. It's an ultrasound and non-stress test that monitor your baby's breathing, movement, muscle tone, heart rate, and level of amniotic fluid. This test is performed on or after 38 weeks gestation. Be sure to visit our blog periodically for lots of great information on pregnancy, childbirth, and postpartum period, straight from the mamas.